Aaron, not necessarily in that order. And if you're tweeting, you can see a picture of them as well. So that's our first presentation, just giving some great background around why the team's been set up, what it's trying to do, what it's done so far, and so on. And then we'll have a little break for 2 or 3 minutes, just for 1 or 2 questions, particularly about their work. And then we'll move on to Julie, who's sitting with me here in Bristol, Julie Bugler, who's a learning disabilities nurse for children, and she'll tell you about her work, about participation in a delivery of an NHS service. And that leaves a nice chunk of time at the end for some discussion and questions and answers. So I think that's all from me, Martin, and so I'm now going to pass over to, in a moment, to the team in Leeds. I'm just going to get the technology right for that. So their first slide is in front of you. I'm now going to give them the permission to take over. So we're over to the Learning Disability Engagement team. Over to you.
Hi, everybody. So my name is Olivia Butterworth, and my job title is a bit of a mouthful. It's Head of Public Participation for NHS England. And I'm going to introduce everybody that's in the room here now, so you hear their voice first, and then you'll get used to it when they speak again in a minute. So, sat around the table next to me is Katie. Katie, say hi.
Hi.
And
hello, my name's Beth Plummer. I'm Jo Whaley.
My name's Aaron Wood, not Aaron.
And I'm Thomas Chalk.
Cool. So, nearly 2 years ago, NHS England kicked off quite a lot of work around a more structured approach to improving the way in which we both hear and involve people with learning disabilities in our work. And part of that was in response to the horrific circumstances of Winterbourne View and some of the other issues that have emerged around not hearing people's voices, not listening to people. So that falls within my wider remit, which my team as a whole, so our public participation team, are responsible for making sure that NHS England really does find new and innovative ways to involve patients and the public, or citizens, or people, I'm not sure I like the patient word, in the way we do our business. So we're responsible for commissioning primary care services, specialised services, health and justice health services, and health services for the armed forces. And in the way we go about that business, we have to make sure that we involve people in how we do that. So we listen to and understand and hear their voice, their experience, and most importantly, their expertise in what they need and want from those services and how they think they could best be delivered. So we do that across the board. Our biggest programme is called NHS Citizen, so you might want to have a look at conversations like that following the hashtag NHS Citizen, or having a look at the website, which you get through Google. It's the most straightforward way to do that. But as part of all of that, we have to make sure we have a way of reaching people who don't ordinarily hear, or who might need to have their voice heard in different ways, or might need better support to have their voice heard. And that's particularly the case with people with learning disabilities who are often ignored. So they might say stuff, but we don't necessarily listen. And we talk in policy wonk jargon constantly, so we make it really difficult for people to understand what it is. So when we publish documents, they're often really difficult to read. They're often written from a policy point of view and not a person's perspective. So going back that 2 years ago, we got permission to recruit a specific learning disability engagement team, who 2 years later, I am delighted that that's in the room with me. That 2-year journey is really important in this conversation, because we deliberately set out to not just employ more people like me, but to make sure that we had people with lived and real experience within that team. We also took a view that we didn't want to adopt a support worker model where we have people in post and people around them to support them to do the things that they find harder to do. we wanted to employ people on an equal basis where we recruit them for the skills that they have and we match those skills in the team so that people can work to their strengths. I'm not going to say any more about that because Thomas and Aaron, I'll talk a bit more about that in what they talk to you about shortly. As an employer, NHS England didn't employ anybody with a learning disability until we managed to recruit Thomas and, losing all my names, Aaron and Katie. And in looking at how we went about setting the team up, it was very obvious that we needed to think about, well, we advertise for jobs on NHS Jobs, which is the least accessible website in the world, even if you don't have a learning disability. All of our job descriptions are written in such a way as to make them mostly completely gobbledygook and jargon. So how do we translate job descriptions and comply with the Gender for Change requirements into a format that people can understand and understand how they can use their skills to deliver that job? And so we had a lot of hoops to jump through of changing corporate processes in a big NHS organisation to make them accessible and to make them appropriate. And I can talk chapter and verse about that, which I won't do, but we do now have, as part of a parallel programme, a learning disability employment programme, and NHS employers have published a toolkit and a load of guidance for HR people and for employers to help people think about how you can create opportunities and work to people's strengths and to use the sort of how you change your corporate processes to make them more accessible and appropriate so you get the best out of people. And so we'll circulate the link, I think, on one of our slides to NHS employers. It's really good guidance and I'd really recommend people have a look at it. I'm not going to say much more, I don't think, other than to explain that the team's structured so that Joe's the team leader and the importance of that role is really clear in that it's very much about challenging and changing the internal culture of an organisation at the same time as really supporting and developing a team of people to deliver to their strengths. And that has to be done as a team effort, but changing the NHS culture of how we work is no mean feat, and I think that that's the same out in provider organisations as it is in a policy-based and commissioning organisation like this one. So the difference it makes is utterly unbelievable in terms of changing people's hearts and minds and challenging people to think about how real they are in what they do, because I think we can often hide behind long words and complicated sentences, so we all end up nodding sagely at one another but not actually understanding what we really mean. So the engagement team are fantastic at challenging us to actually say it like it is in a way that everybody can understand. And actually what we're finding is that that improves everybody's understanding, not just people with a learning disability. So I'm going to hand over to Joe, who's going to do a kind of interview, really, with the team so they can tell you a bit more about themselves.
Great, thank you. So we'll split this up, haven't we? So Beth, can you start? Who are the Learning Disability Engagement Team? What is our purpose and what are we leading? And I'm going to write down all your answers.
Hello everyone, my name's Beth Plonner and I'm here presenting today with my co-worker colleagues, Katie Matthews, Thomas Chalk and Aaron Wood. We work together in the NHS England's Learning Disability Engagement Team, and our purpose is to build a bridge between NHS England and people with a learning disability and/or autism, their families, carers and supporters. And what we want to do is make sure that people with a learning disability or autism are able to be part of decisions about the services they use, because these people are the experts. They know what works for them and they know what doesn't work. So we should really tap into the knowledge and the experience that they have. The main piece of work that we're leading is building a network of people with learning disability and or autism, their families, carers and other people and organisations that support them. Our network, or we call it a forum, met for the first time last Friday in Sheffield. And the things we discussed were building the right support, which is about bringing care closer to home, and NHS England's approach to Easy Read. We talked about a lot more, but they're two of the main things that we talked about. Other things that our team is leading is helping people who work on NHS England projects, such as medicine management, the Transforming Care programme, and care and treatment reviews. We're trying to help them talk and listen to people with a learning disability. As Olivia said, we're also helping NHS England be a supportive employer of people with a learning disability, as well as making sure information provided by NHS England is in a clear, accessible and easy to understand way. And you can find out more about that on the Accessible Information Standard, which we can post a link to in the chat box.
Lovely, thank you, Beth. Now Thomas, can you tell us about the importance of learning and working together?
Yes, I mean, I think the crucial part of this is the together bit, that actually, as Olivia was saying earlier on in the presentation, although my background is in support work, I'm very much not here as a support worker. I'm not here working with Aaron or with Katie to support them with things they need support with. I'm actually here because of what they can do, what they know, what they can help me with as much as what I can help them with. And I think when we get that right, which we frequently are doing, it makes us all much, much better at our jobs. I think a very good example at the moment of something where I'm definitely not the person doing the supporting would be social media. I'm just about old enough that I think Facebook and Twitter is all beyond me. And Katie's giving me that look. It keeps giving me that any day now I'm going to get taught, because she's the expert. This is, you know, regardless of whether or not she has a learning disability, this is what she knows about much more than I do. So I think recognising that everybody has something positive to bring to the team, a strength to bring to the team, is a very vital thing, and it's part of working together, as you would in any team with any collection of people. What we're doing as we go along is learning how that works, learning how to make the most of that, learning those things where we might not have quite have got things right about how we work together as a team. I did get Aaron and Katie to help me write this part of our presentation, actually, on the grounds that, although I've got some insight into how it's been working in the team, I think their insight is probably, well, certainly at least as interesting as anything I would have to say, if not more so, because they're the people who are in those fabulous new jobs that there's much less precedent for. I'm a bloke working for the NHS. There's been millions of us in the past, probably millions in the future. But actually, it's having Aaron and Katie in the room adding things that really makes the difference. I think the main thing I would remind people, and it's not going to be news to anyone out there, but I think it's really worth underlining, is having a learning disability doesn't mean someone cannot learn new things. Yes, we are here to try and help play to everyone's strengths, to draw out everyone's strengths, but actually we're not here saying, right, Aaron and Katie, you're good at these things, that's it, that's all you will ever do. We're all gently and supportively pushing each other to try more, to do more, to get better at everything we do, whether that's individually or as a team. Olivia made mention earlier of some of the adjustments that would need to be made to improve the chances of actually being able to successfully employ someone with a learning disability. Some of those are those big corporate infrastructure-y things that attract names like policies and procedures and all sorts of things. I think it's fair to say that actually getting on and working day to day, there's all sorts of very small, simple, reasonable adjustments that you can make. In the same way as people may need to adjust the way they communicate with me, perhaps I need to adjust the way I communicate, say, with Aaron or with Katie or with whoever. You're not going to get everything right first time. We don't get everything right first time. It would be ridiculous to think that we did. What we are trying to do, and what I would say is working very, very well in the team, is going, we got a lot of things right, let's, you know, celebrate those and be really pleased with those. And we've just seen somebody said something very nice about our event in Sheffield. But we're also taking the time to go, actually, what didn't work so well? And again, this is not a new thing. This is what teams do all the time. So it's very good to be very ambitious and to push each other gently and supportively, and to be very honest about what's working, what's not working, and what do we want to do next.
Lovely, thank you. So I'm going to push us on to the next question. So Aaron, can you tell us what you think is a meaningful job and why it's important to you?
Good afternoon, everybody. A meaningful job is a job that suits your skills and abilities and that you enjoy doing every time you are at work. The reason why it is important to me to have a meaningful job is because I feel accepted and equal to others without a disability. I also bring real-life experiences and knowledge of having a disability. I get to do one thing that is my absolute passion, that is public speaking. I love it when everybody's attention is on me.
That's very true. Aaron was disappointed that there is no video link for this WebEx. Let's just leave it there.
I'd also like to help other employees at NHS England if they need my honest opinion on Easy Read, where I can be very honest. And also helpful when telling people what changes need to be made. Every day I learn something new working at NHS England, and I love to network across the country. I'm so proud to say I work for the Learning Disability Engagement Team, and I'm really enjoying working on topics such as Easy Read, bringing care closer to home. I also enjoy attending the NHS Choices focus groups and committee meetings in London, also the appointment event, which is where we talk about with other organisations, how employing people with disability can make a difference, and also what reasonable adjustments need to be made. And because I gave them good feedback, I've now been appointed to chairperson for the next appointment events in Manchester and London. Working for NHS England has really opened my eyes to certain issues.
Great, thank you very much, Aaron. And I see you have a fan who saw you in action in Sheffield as well. Thanks, Trudy. Anyway, our final question, last but not least, Katie. Now, what can you tell us about what people gain by employing someone with a learning disability?
You would gain knowledge, experience and expertise. We know our needs, and most importantly, we know our rights. So we need to tap into our know-how. My know-how is having Down syndrome. Life with Down syndrome has been quite true for me because I've never really fit into society, mainly at school, because I spent most of my education in mainstream education, and it never really moved into the school culture, let's say. And it's been a real challenge and barrier. One of the barriers is my speech problem. I dabble, and if I dabble now, please let me know. But I'm overcome on challenges and barriers, and what I've achieved, having Down syndrome is unbelievable. I've come on leaps and bounds, mostly with confidence, and that's mainly because of jobs like this, when everyone I've worked with has accepted me for who I am. But not only that, I've also been a family carer for many years to my brother, who was severely disabled. I'm extremely proud and honoured to be a carer, but it has had a massive impact on my life, mainly socially, because growing up, I wanted to be a normal teenager, going out with friends and doing normal things. But I couldn't do that because I was restricted. But I was restricted, but it's given me experience that has allowed me to have jobs like this. It has its challenges, it has its barriers. I can tell you horror stories about the local hospital, but I can also tell you amazing stories about our local hospice that has been a lifeline for me and my mum. Professionally, I've also been a crash worker for children and infants with Down syndrome. I youth worker with teenagers and young adults with Down syndrome, and as a support worker for adults with learning disabilities. So together, my personal experiences and professional experiences have come together to give me this job, to make me who I am now, and I'm so proud to be a part of this team, because if I didn't have this team, if I didn't have this job, I don't know what I'd do, because this is what I get up for in the morning. So you don't just want us, you need us.
Thank you, Katie. That's a great way to end. Martin, can we hand it back to you from Leeds?
Of course, thank you. And thank you so much to the team there, to every single one of you. That was absolutely great and inspiring. We've had a few nice little comments and also some ideas and some thank yous in the chat box. So do take a look at those, everybody. I'm just going to give a couple of minutes, because we want to move on to to Julie's presentation in a moment. But a couple of minutes for anybody who has got a question. You can either, as I said, type it into the chat box, or just raise your hand, and I'll just scan up and down. Still looking. Somebody alert me to see if we can see anybody wants to ask a question at this stage. I don't think there is. Well, that's okay, doesn't it? Gives us more time to move on in a second to my colleague who's sitting in the room with me at the moment, Julie Bugler, who will introduce herself, of course. And so what we're putting together today's presentation is the guys in Leeds who are working particularly hard around employment. Obviously, that's one of the things we've heard. And Julie I came across last year when I was doing some work around participation in delivering of services. And Julie inspired me, particularly when I went to meet some of the people that she will talk about, some of the parents and young people that she works with. So, Julie, over to you.
Over to me. Thank you very much. I really enjoyed your presentation from Leeds and London, I think you were, weren't you? Really inspirational, and it's made me think, as I was sat here thinking about the young people that we work with, and just imagining maybe in a few years' time that they might be doing some stuff like you, and really, really inspirational things. That was really, really nice to hear. Thank you. So my name is Julie Bugler, and I'm a learning disability nurse in Bristol. I work with the Learning Disability Team for Children, and we work within the NHS Trust. We set up a participation group about 5 years ago, and the reason we set it up was because we were really having difficulty trying to create a leaflet to tell people about our service. We kept getting it wrong, we just didn't really know the words to put in there, and then we realised we were doing it all wrong, so we started to ask parents to come along and be involved in designing a leaflet for our service. And they did a fantastic job, and originally it was just one task. It was originally to think about creating one leaflet, but that was 5 years ago, and you'll be pleased to know we finished the leaflet and we carried on working hard, creating other leaflets and doing lots and lots of other things, because we realised that actually we can't do these things. We think very differently to parents and carers and young people. And we really felt that we couldn't work in the way that we were working. We needed to always ask young people and parents for their views. So we started to think about other things that we wanted to change and ask the views of the people that we were working for. So we carried on joining together, really joint work was the way forward. And we grew from working with just a very small team of parents to then having parents and young people on the participation group. And from that, then we decided that we would do some specialist groups for young people with learning disabilities in special schools around Bristol. And we've currently got 2 young people's groups who are really active in participation. And we're continuing to think of ways that we can always ask young people and parents their views and making sure that they're involved in lots of things that we do. We were really thrilled to be nominated for 2 awards in 2013. We won an NHS Leadership Award for participation, and we were leaders in the South West for that in 2013, which meant that we picked up a lovely award. We went to London for a big celebration evening, and it was so lovely to do that with the parents and our team. One of the parents is here today in the audience, which is Tony, and I'm just thrilled that Tony's here because he can hopefully say something regarding his involvement when we break after my presentation. Like I said, through the work of the participation group, we redesigned the way that we work, and now we would never consider doing anything unless we thought of the opinions and thoughts and views of young people and their parents. And so often we'll ask parents and young people to help us redesign different things, whether that's particular administration tasks or training, recruitment, going to teach students at university about participation. There's a huge list of things that we do, and we're continuing to do. We're always finding new things that we can be involved in together, and it's a great spiralling upwards kind of team that gives us such a buzz, actually. When we meet together and we work together, we are just absolutely buzzing from the excitement of working together and redesigning things. So that's how we started off. I'll just move forward onto a slide here. I just chose to put this slide on because it represents participation for me, just thinking about the ladder that we climb through participation. You've got the little boy at the bottom who's supporting the ladder. You know, we all support each other, we explore, we challenge services and we challenge boundaries, and we're very brave, and I think it's about being brave and pushing and taking some risks together. Teamwork, and the other thing that it is extremely fun, which we all definitely feel that when we've done a piece of work, we certainly have a lot of smiles. One of the things that we've been really busy with is recruitment, and so I just wanted to talk about 3 different perspectives about recruitment that we do within our team. So the young people's perspective, we have a small panel of young people and parents that join the recruitment panel or recruitment team, and they're very busy from the outset. As soon as a job's advertised, then they will be looking at questions, trying to work out what they want from a person, looking at job descriptions so that they understand what the person is actually applying for and they understand that role so that they can base their questions around that. And they look together with somebody from the Bernardo's team who are very heavily involved with us as well in the Helping Young People Engage team. So somebody will go and work with a young person and look at designing questions and look at scoring and what we're really looking for in the candidates' answers. One of the young people that wrote this quote here, he's actually retired now at the young age of 16, retired from participation, which was wonderful to have him for the short time that we did, but he retired because actually he felt that he wanted to go and socialise with his friends more than come and be busy with us, which was a wonderful thing for him because he grew in confidence through the work we did together, and then he decided that he was just wanted to fly away really and go and be with his friends, which was wonderful. And he said, we get the chance to give people the opportunity to have a job that they really, really want. If they didn't come and see us, then they wouldn't be able to have that job. And that's what he felt. He felt that they really did want that job and that he was able to give them the opportunity to answer questions and then he could give them that job, which was a real achievement that he was part of the panel. And Tony, who's in the audience, Tony's been involved in recruitment as well, and hopefully he'll talk a little bit about that as well. And his son was also part of the recruitment panel, and it still is. And what's so lovely is that they come along on the day and they dress smartly and they really know how to kind of manage the situation. And it's a really big thing because they score independently, they ask their own questions, they listen carefully to the answers. And after they've scored and after the interviews have taken place, then they'll go and meet with the professional panel and they decide together about who actually gets that job. And so it's not quite equally weighted, but it's certainly, they have a huge influence on who gets that job. And they do understand the importance that they play with that. I'm just going to swap over to my next slide. I'm just getting used to technology here. And then the parent's perspective. I asked a parent who's actually recruiting right now. She's busy recruiting somebody for our team, and so she couldn't be here in the audience today. And so I asked her the other day if she could give me a quote about what it's like for her, for her perspective, and this is what she said: it's the start of a chapter for someone, and it makes me feel warm and cosy to think that I was there at the beginning of it. She's very proud of what she does, and she says it's something that's never ending. She knows that now she joins a participation group, she'll be there until the end, because she really, really enjoys it. And for parents that work with us, we see a huge increase in their confidence, their self-esteem, that they really feel valued and very, very worthwhile. And quite a lot of parents are very isolated, and we found that the parents then have more than, it's more than just coming in and working together and looking at services. Their isolation disappears, they feel more sort of social, more supported and very, very valued, and that's really important to us to keep that going. And then just thinking about the team's perspective, it's everything. We don't think of, we can't ever work in the same way as we used to before we involved parents and young people, and we're very proud of the work that we do, and we're very proud of the parents and young people that work with us. During every piece of our work, every team meeting, everything, we just always think about the parent and young people's voices, and wherever we can, then we ask. We learn so much from them. We see things in a very different way, and we can't imagine what it was like working the way that we used to. We've written things in much more child-friendly language, so things like the job descriptions is written now in a child-friendly language. Young people have been involved in that as well. And so all those kind of things are so important to keep going, to make sure that everybody's involved as much as they can be. So challenges to participation. I've made this really fuzzy because sometimes that's what it feels like. It feels like you just can't quite see the end. You can't quite see what you're trying to achieve. And some of the challenges that we have are around management support. We were blessed with a very great manager who has continued on with his career now and gone elsewhere, but he was very supportive of the work that we did, so we were very fortunate. And it's great to see that there's managers in the audience today, and I think our message as a participation group is to managers wherever, is to continue to support any participation work that people are trying to do. We find that lots of people within our training, when we're training the staff about participation, that they always bring up the issue of money and funding and time, but actually we've realised through our work that by using parents and young people to help us design services, it doesn't cost money and it doesn't take that much more time. Well, actually, the time that it takes is greatly invested. I think that's the difference. One of the other challenges is that the young people that we work with, they grow up and then they decide that they want different things in their lives. So then we have to think about other young people that we might be able to train to come and work in the way that we work together. Transport is a difficult thing. Sometimes parents find it hard to get to us, but come which way, they always manage to, which is wonderful. And I think the other challenge is that sometimes people just don't understand it. They don't seem to understand the value of asking people their opinions, which really saddens me. I've just been asked to move on a bit, so I could ramble on for ages.
Just a bit more time for discussion.
My absolute joy.
We can cover, we'll send the slides out, a message to everybody, so there's some great stuff that you can read.
Tips for getting started.
Why don't you move to that'd be great to round off with that, Julie, and we can...
So what have we learned through participation? Just some of those words there. We've learned to listen, to create, to think and share, and to express ideas together. But I think that's the one thing that we've learned is this togetherness, which is what the other presentation was around as well, about working together. And where will we go from here? As far as we can, I think we'll just keep on going, always thinking about different ways that we can work together and be involved in joining ideas together and making sure that young people and parents are involved all the way. Thank you very much for listening, and I'll pass you back to Martin.
Thank you, Julie. Sorry to cut you short a little bit there, but there's so much to talk about. But I do want to give people who've been listening mostly a chance to add ideas, ask questions of either of our presentation teams, or make suggestions and ideas. So we're getting some nice little things in the chat box, as we can see, some thank yous. Anybody want to, as I say, ask a question directly either in the chat box or by raising their hand? It's all very straightforward. There must be somebody who wants to ask a question.
I wondered whether Tony wants to, to say something.
There's two hands raised. Yes, thank you. So I'll ask, let's say Tony first, if I may, and then Trevor. So Tony, I think you're off mute anyway, as they say. Are you there, Tony?
I'm there, yeah. I'm
lovely. So we can all hear you. So over to you. Question or comment or something to add, Tony?
Yeah, just really wanted to lead on from Julie's talk, because I've been a parent on the parent participation group since it was started 5 years ago, and I feel very privileged to be part of it. I'm the sort of person that's always gone to meetings and appointments and often look at the way things are done and think, well, you know, if only they did that slightly differently, or if only that was changed, it could make a big difference to the outcome. But normally you don't get that opportunity to have a voice. But in the parent participation group, you have a voice, and you know that if it's something that we all discuss and we're all in agreement with, they will do their best to put it into practice. The team are absolutely committed to participation. When I started sort of 5 years ago, as Julie said, it was literally, I was asked just to go to a meeting to look at a leaflet, and at that time that was all it was, to go through a leaflet and try and redesign it. We had no idea, you know, we would be where we are today. But I did actually feel at that stage, you know, was this just a tick box exercise? You know, they've been told, the group have been told they had to get parent participation in place. Was it just something that had to be done? But it was absolutely clear from day one that that certainly wasn't the case. The whole team are absolutely committed to participation, absolutely on board to listen to all the ideas from the other members of the group, and as I say, where possible, put those into practice. And it's been an amazing group to work with for the last 5 years. We've done so many things since designing the leaflet, as Julie said. And I think she also touched on as well, it's changed our lives as well, because, I mean, from my point of view, if they told me in the beginning that, you know, we want you to design a leaflet and we'd like you to talk at conferences and go on recruitment panels and talk at the university, I would have said at the time, you know, there's no way I would have done that. But over the years of being involved with the group, these are all the sort of things that we've done, and we all say that we've grown in confidence completely. And the young people as well, my son has been involved now for a number of years. My son's got Down syndrome, and he absolutely loves it. He loves going and you know, being on an interview panel, and he's talked at the university and he's talked at conferences, and again his confidence has grown immensely over the years. It's been an absolutely amazing experience for him. So, you know, I'm just so glad that I've been part of that group over that time.
Thank you, Tony. And it's, for the rest of you, it's also to say to Tony, it's nice to hear you again, because I met Tony with Julie a little while ago, and when we send out the details of this presentation, the slides and recording, I can also make a reference to an interview, a longer interview with Tony that he gave along with some of his other parent participation colleagues. So thanks for adding that to that sort of richness from your point of view, Tony. Trevor, you have your hand up, and I think you've unmuted yourself. Are you there, Trevor?
Good afternoon, everybody. Yes, that was a brilliant talk there, Tony, and very moving indeed. Just to explain who I am, I live in Nottingham. I've got a son who's got a learning disability and autism. He's 44 next month, so I've been a carer for 44 years and counting. But what I'd like to bring up for discussion is the employment and people with learning disabilities having a job. I think it's very important to to make sure that the carers and parents know exactly what the person with a learning disability wants, basically. There's been no talk about person-centred plans. My son has one. I know lots of people, excuse me, lots of people with learning disabilities with people with learning disabilities that have person-centred plans, and person-centred plans is a voice for the person who's got a learning disability, and it's a document that's never closed. It's not owned by anybody. It's not made to be shelved or anything. It's there for the person with a learning disability, as I'm sure a lot of us already know about. But I think the person-centred plan, if you've got one in place, needs to be revisited before you think about putting them forward into the job market, so to speak, to see what their needs is, and not assume that the needs are still the same. Because sometimes it takes a person-centred plan to give a person a voice, and for the people with learning disabilities that have not got a person-centred plan, I think it'd be a good idea to get that in place, and then everybody's clear on what their needs are, what their likes are, what their dislikes, and therefore you can find a true position of their strengths and weaknesses, and therefore you can actually, I think the word is chisel out a job that actually is honed in at their strengths. I just wanted to put that in the discussion to see if anybody can add any more meat to that.
That's really helpful, Trevor. Thank you. I'm just going to stop you there just to see if anybody in our Learning Disabilities engagement team in Leeds has got any experience or views about person-centred plans and the employment aspect of that, because I know it's quite a hot topic politically as well, I think.
Hello, this is Thomas up in Leeds in the Learning Disabilities engagement team. I'm not going to claim to be an expert on employment in learning disabilities. As I said earlier, this is something that I think to all of us in the team is still quite new. We're not the first team that includes people with learning disabilities, but we're certainly not sort of catching up on something that's happening as much as it should. But in the other half of my working week, I work for a supported living service, and we obviously get a huge amount out of either person-centred planning or person-centred reviews, which are very much the same thing. I think the point Trevor was making is probably a really, really useful one to recognise that nothing will work if you only look at one aspect of a person's life or a person's identity. Actually, what makes people who they are is a bit of everything. I think the best example of that we've had today is really Katie. She spent far less time talking about having a learning disability than all these other parts of who she is, be a family carer, a family member, and all of those things. So yes, I think I would agree with Trevor that something like person-centred planning, person-centred thinking about who someone is really is a very, very good way to start. It's actually thinking about who is this person, what works for them, what makes them tick. And it was very good that you said what was important to them, not just what's important for them. That it's not just about what support do they need, but actually what are those strengths? What do they bring? What is it about this person that makes them excited and enthusiastic, and how can we match that up with a job where that person will be able to shine and will be able to do a better job than anybody else?
Thank you, Tom. Any other thoughts from Leeds or? No, thank you. Any other questions then, or comments? Inspirations, ideas? I know there's some more. I'm sure there's some more. Ah, Trevor. Trevor wants to come back. Yeah, Trevor, over to you again.
But yes, in respect to the participation group in Bristol, I believe, isn't it? We've got similar groups along these lines in the Learning Disability Partnership Boards. I know they're all pretty old hat now, but the one in Nottingham, the one in the city, and there's another one in the county. They do work very well. They're very bright, very vibrant in dealing with problems of the day, and all the problems are always local basically, but it gives people with learning disability lots of voice. Much like the participation group you have in Bristol. The point I'd like to make is supporting people organise their learning disability partnership boards all over the country. Most cities and towns have had them, and I think quite a lot, although I've not come up with any figures, how many are still exist. But where they do exist, you'll find carers like myself responding, and also a lot of people with learning disabilities who are eager to have a voice as well. And I think there's a lot of information to be found in these partnership boards if it could be gathered, basically. That's my point.
Yeah, thank you. Thank you.
Say something?
Yeah, Julie, over to you, Julie.
Thanks, Trevor, for that. That was really interesting. I think you're right, is that there's probably lots of work as part of great projects of participation around. And with the organisation that I work for, there's loads and loads of stuff going on, but actually no one really hears about it. It seems to still be quite a quiet kind of piece of work, unless you're shouting from the rooftops about it, which we are, because we're just so passionate about it. There's so much going on, but it's just a shame that we don't hear about it all. Within the trust that we work for, we often have clinical governance sessions, and we hear about all the pockets of wonderfulness that's going on, but actually we only hear about them at those times. So I think you're right, probably in every city there are pieces of work going on, but it's just not really that, it's not that transparent at times, which I think is a real shame, because I think everyone should be shouting about it.
Thank you, Julie. Is there any more? We're going to draw to close in a couple of minutes. Any more final thoughts or questions or comments? We'll have a little goodbye from both the presentation teams in a moment before I say something. A little comment there from Trevor. Thank you very much as well. So in a moment, if there aren't any more comments or questions, I'm just looking down. I think, is the NHS team hand still up? Is it still up?
Yes, no, it's Jo in Leeds.
Yeah, over to you, Jo.
Just coming back to Tony and Julie, really, about, Tony said that this felt different, this parent participation group felt different and it wasn't tick boxy. And I wonder what the magic ingredients he thought were that made it felt real.
Trevor, can you take yourself off mute?
Tony and Julie, what makes it real?
Julie, sorry, yes, Tony and Julie.
This is Tony again. I think it's probably the way that we've always run the group. It's always very informal. It's not a business-like meeting. You know, we run it in a very informal way. We always bring food to the group, which has always been a very important part. Everybody brings some food. We eat as we're working. We always get the job done at the end of the day, but it's always very informal, very enjoyable, and I think that's why it's kept going. Because we all enjoy coming. It's not like coming to work. You get the job done, but we enjoy doing it, and we know that at the end of it, we are making improvements.
Thank you. Any final word from Julie on that? Is that a good summary?
It's a great summary, Tony, and it's just, yeah, like you said, it's very informal, isn't it? We all share food, we share energy, and we share ideas, and then we share the celebrations at the end of it. Wonderful.
Great.
Yeah, I think you summed it up really well, Tony.
Yeah, and I say, a final word from me, I was privileged to come along to one of those meetings with Tony and some of the others as well. So I think people are just signing out because we've got 1 minute before 3, so I'm just going to say a few final thank yous and remarks. As I said at the very beginning, we will put together the recording, these presentations and the chat box, so I'll probably keep out the weather forecasting bit, put them all together as a little bundle on the Patient Voice South website. It might not be for another week or so, but we will email you when it's there and ready. I will also email you with a very short questionnaire, if you don't mind filling that out, to give us some feedback about future seminars. As I say, everything's recorded, and we'll also have the contact details. I think they're on the slides, but I'll make sure you have them as well for all of our presenters. So people are saying goodbye, so I'm actually going to ask firstly the Leeds team to say goodbye, and then I'm going to pass to Julie on my left to say goodbye, and then we can finish the seminar. So firstly, over to Leeds for a few seconds of goodbye from you.
Goodbye, thank you.
So goodbye from Olivia, and a particular goodbye to Amanda S., who's working as the Assistant Manager at Bournemouth People First. So I hope you can hear us. Keep going, keep working. I'm sure you're doing an amazing job. And thanks to everybody that's joined us. It'd be really great to keep in touch.
Great. Thank you. Is that everybody there? Thank you. I hope you've eaten enough food and fruit, of course, up in Leeds. And over in Bristol, we're just going to say goodbye from...
Goodbye from Julie. Thank you very much for taking part. It was really great to hear about all the good stuff that's going on.